Good morning. Good morning. Thank you all for spending time with us today on this Texas Criminal Justice webinar on smart and innovative solutions to create better outcomes for people within the justice system and lower recidivism, save money, and to continue to innovate so that we can achieve a smarter and smaller prison system and juvenile justice system. So as background, my name is Doug Smith. I am the Senior Policy Analyst with Texas Criminal Justice Coalition, and this is our team. This is a good 70% of our team. And so we've been working exhaustively since the pandemic began, since we started to see raising cases within our prison system and in our youth justice system. And when we realized that Texas was going to have to make some tough decisions with respect to the budget, and we see now that we're not going to have as much revenue as we did last session, and that economic activity right now might perpetuate that problem. So we realized that now is the time to look very closely at how the state is allocating its money into our prison and youth justice system to see if we can do it even better at a lower cost. And so that is our Spend Your Values framework. And we're going to put that into the chat for everyone. So what I would love to do is go ahead and get our webinar started and to begin to introduce our team members. So again, welcome. If we go to the next slide, please, that would be terrific. Great. So we have 7 solutions, and we're happy to work with any legislative office to talk through smart, innovative solutions even beyond this, but 7 solutions that can be assured that they're going to lower cost and they're going to create better outcomes. And those revolve around promoting rehabilitation and incentives for release in our state jail system. That's called diligent participation, creating more effective strategies to serving people on probation, reinforcing high-performing counties in order to elevate counties that are sort of struggling to get their probation revocation rates lower. We also see opportunities to create a smarter common sense parole system to improve our substance abuse felony punishment facilities, which are a form of in-prison therapeutic community that we'll talk about. We also research reentry housing strategies to help to identify people without a housing plan who might be staying in prison after their parole date simply because they don't have a housing plan, and being able to catch that early and create smart solutions in the community. We're also going to introduce you to members of our youth justice team to talk about real opportunities to create better outcomes for youth in our juvenile justice system, and also youth who become entwined within the criminal justice system through their education systems. And finally, we're going to talk about opportunities to continue this trend that the legislature has started to right-size our prison system to continue closing prisons and saving cost. So if we could go to the next slide, that would be great. So I'm super happy to introduce you to one of our newest team members. This is Devin Driver, and Devin Driver has been doing just amazing research on state jails and on probation. And so I'd love for Devin to talk to us about this opportunity around diligent participation.
Awesome. Thank you, Doug. And thank you, everyone, for being here. Diligent participation is an amazing opportunity for us to take on. It's also the Senate Bill 122 and House Bill 953. One of the big things that we see is that individuals incarcerated in state jail felony facilities can participate in diligent participation, which is going into these programs, either educational, vocational, treatment, or work programs, and be able to give credit for the time spent doing these programs. Similar to good time served, but this is really being part of rehabilitative programs that help reduce recidivizing back into the prison system as well. One of the big things is that judges have to presumptively approve the enrollment of an individual into diligent participation. So right now, as they get sentenced, judges have to opt in. And so we're seeing that less people are being enrolled in these rehabilitative programs, which contributes to longer sentences, which is more money spent on housing people in incarceration, overpopulating prisons in general, and then a higher recidivism. And also it can lead to relapse as well, because we do have a treatment program. So if we can get ahead of substance use and things like that, this will be good for the community and public safety as well. So our smart and safe solution that we have for diligent participation is to have TDCJ be solely in charge of enrolling individuals automatically into diligent participation, excluding days for disciplinary actions per the individual. But like we said, giving people the opportunity to be in rehabilitative programs, see it pay off, and then be able to take some time off their sentencing, which again is saving taxpayer money, it's saving Texans money, and then giving people better opportunity when they're re-entering society. From the fiscal hearing last legislative session, they saw a probable net positive income from diligent participation and the use of it around $63 million. And that's just the fact that we're not paying for, again, people to stay in incarceration past their release date when they could be out a little bit early. And then again, we're saving money by not having people come back into the prison system for committing other crimes or relapsing into drug use that leads to other things. And so this way we can work together on both sides.
That's wonderful. Thank you, Devin. And I want to invite folks who have been attending today to use the question and answer function so that we can catch your questions. We will leave time at the end. But if you want sort of real-time answers, then we definitely invite that. Thank you so much. So I would love to introduce Teresa Lauman, who is also new to the team, and give a plug to TCJC. We do have a lot of people get their start with us through field practicum or fellowship programs. And, you know, it's a great way to really learn policy, learn justice reform. And, you know, so we're really super lucky. So if folks are getting their law degrees or social work degrees, we'd love for you to join us. So I would love to turn this over to Teresa, who's from Columbia University.
Awesome. Okay. Thank you, Doug. So as you said, my name is Teresa, and I want to really break down how we can advance effective probation reforms, improve public safety, and also save some money. So first I want to unpack the problem. Probation is commonly framed as an alternative to incarceration. However, it is actually a costly driver of mass incarceration. And we have seen that nearly 1/3 of people incarcerated in Texas each year, so that's about 22,000 people, are there as a result of probation revocation. So instead of reorienting individuals back into society, the probation system is landing large numbers of individuals in jail and prison. Additionally, Texas doesn't have one centralized probation system. So while some counties take more of a case management approach and they focus on rehabilitation, other counties impose lengthy probation terms, which are sometimes up to 10 years. And they revoke for technical violations. And so examples of technical violations would be things like missing an appointment with your probation officer, inability to pay a fee, going outside of a specific set of geographical boundaries, or even lack of employment or having trouble getting a job. So we're seeing that there's wide variance in probation success rates. And actually in 2019, a number of Texas counties saw probation failure rates of well over 50%. So why this matters is because we've essentially created this revolving door effect. So people go from probation to jail or prison, and then back to probation, and then this cycle just continues. So the statistic that I just mentioned, in 2019, a number of Texas counties saw probation failure rates of well over 50%. In some of those counties, 70% of those revocations were due to technical violations. So if I could break that down further, people aren't necessarily, they're just not committing new crimes. They're being reprimanded for small errors, and these are errors that really anybody could make. So translating into dollars, it is really expensive to house someone in jail or prison versus working with someone on probation. So probation supervision costs about $4.39 per day per person, while prison costs $62.34 per day per person, and this is in Texas specifically. Thus, the aforementioned 22,000 people who get revoked each year in Texas and sent to prison, that ends up costing taxpayers about $1.27 million per day. So that's a pretty big price tag there. So instead of this money being able to go into community wellness, we're actually investing more in prisons. And on top of that, it's really important to note that low probation success rates do not equate to greater public safety. And actually, really quick, I just want to just kind of break down this graph over here on the left. So we use the data from the fiscal year 2020 Community Supervision Stat Book, and we were able to calculate a statewide probation failure rate by taking the total number of revocations over the total number of terminations. So termination could be successful, early termination, or revocation. So we found the statewide average percent of revocations, which is 34.8%. So the graph is centered on the statewide average, where those two sections, the gray section and the blue section, where they meet. The y-axis, those are all of the community supervision corrections departments. And then the x-axis is the percent increase from the state or decrease from the statewide average of 34.8%. So that in the top right-hand section, you see all that gray. Those are all community supervision corrections departments that have a higher failure rate than the state average. So we're just, in a nutshell, we're seeing that a lot of these CSCDs, their failure rates are pretty high. And next slide, please. Awesome, thank you. Okay, so smart solutions. We definitely have a few. First, require the Texas Department of Criminal Justice's Community Justice Assistance Division, that is a mouthful, so CJAD, require them to create an annual report to inform probation departments and judges with a greater than 50% failure rate of the necessity for corrective action. And then CJAD will also direct existing grant funds to higher performing counties so that they can train and provide additional support to counties that are struggling. And that also encourages sharing probation best practices. And then lastly, CJAD will require that probation departments use some of their existing grant funds to hire for certified peer support specialists, certified recovery coaches, certified reentry support specialists. So these individuals will work to actually successfully help people who are on probation to complete their requirements. They'll prevent revocation and also to provide relapse prevention support. So really, we do have a great opportunity to disrupt this revolving door effect, to actually improve public safety by investing our dollars in community wellness, and to create a probation system that shares best practices and collaborates on how to achieve higher success rates. So all of this is totally possible. Thank you.
Thank you so much, Teresa. I'll just kind of add that Teresa and the team actually contacted the jurisdictions with sort of lower than average success rates and those in higher than average success rates. And we want to thank those departments that actually participated, develop some really good relationships with counties that were falling below the average, and they were really happy to become alerted to that and began to, and they were actually in the process of making some improvements. So we do want to recognize those great practices. We also want to send a special thank you because we really need to thank the El Paso CSCD, Community Supervision and Corrections Department, and just applaud them. They're doing just absolutely phenomenal work among a lot of other community supervision departments, because there are quite a few that are really, really excelling and on behalf of clients. So want to actually call them out. We are going to publish just where different, when we say counties, what we mean are community supervision corrections department and the courts within it. We'll publish, where particular counties are sort of landing on above or below the state average. So thank you so much for our team and the work on that. I would love to move on to the next slide. Oh, wonderful. So I am so happy to introduce Shruti Patil. Shruti came to us last summer wanting to do a real deep dive into in-prison therapeutic communities and how they're working in the state, and has led the effort to do thorough research and develop smart solutions. So Shruti, do you want to take it from here and talk about in-prison therapeutic communities?
Yeah, thank you so much, Doug, and hello to everybody here today. I wanted to start off by first describing what substance use looks like in Texas and the SAFE-P program itself. So as of right now, Texas is second in healthcare costs related to opioid misuse at $2 billion a year. The other thing is that, Texas does seem to be the problem of substance use seems to be worsening in past years. And so it's really vital for us to get ahead of this problem and give substance use treatment to those people that do really need it. And so going into SAFE-P costs taxpayers $50 million per year and has a 48% recidivism. And TCJC thinks that this program can be made into a smarter, more innovative program that serves the people that it needs to. And so in our research, the research that TCJC did independently, we found a lot of really interesting findings based on the experiences of folks who have actually been in SAFE-P. And so some of those include, like the use of stress positions, and there's no evidence that these stress positions actually help at all with substance use treatment. It's not medically backed at all. Also, a lot of residents talked about sleep deprivation. Many of them were averaging maybe 4 to 6 hours of sleep a night, again, far lower than what would be expected of an adult. There is also significantly lacking mental health services in the sense that like 30 people would be attending a single group therapy session. And, with 30 people, it can be really hard to get that kind of nuanced medical attention that a lot of these people really do need. And because of the role of trauma in a lot of substance use issues, and as well as like mental health issues, we really do believe that mental health is a vital part of SAFE-P and needs to be a vital part of SAFE-P in the future. And so when we talk about solutions and ways that we can improve these programs, we want more rigorous reporting standards for SAFE-P. And when we talk about that, we mean that TDCJ currently reports very little statistics and data on SAFE-P. They don't report absconding rates. And as you can see from the recidivism rates that they do report, it is very high. And so we think that publicly available information on the vendors, and in addition to other statistics like aftercare who is able to access Medicaid, SNAP, housing vouchers, in addition to like staff turnover rates and reasons that the probation might be revoked from folks who exit SafeP, are really vital for us to actually characterize whether or not SafeP is serving these communities. The other part of it too is that these reporting standards allow for the potential termination of unsatisfactory vendors. And that's really key in order to improve these programs, right? Like if a vendor isn't doing its job in these facilities, we need to be finding another vendor. And so in order to do that, we need to have more rigorous reporting standards. The other big piece of it is that we want to ground SafeP in medical and medical education and psychology. And when we talk about that, we talk about like a much more robust mental health treatment in SafeP, in addition to things like not placing people in SafeP based on a plea agreement. As of right now, people can be placed in SafeP on a plea agreement regardless of whether or not they meet a clinical criteria of substance use disorder. And that currently is a system that doesn't quite work. And we believe that that might be a reason behind SafeP having such a high recidivism rate. So we would like for in the future for individuals who are placed in SafeP to have to meet like a very specific clinical criteria that will be developed by medical practitioners and psychiatrists. Additionally, we would like to establish a client bill of rights. These bill of rights are very common in other treatment facilities, other rehab facilities, other community-based treatments, but they aren't available for SafeP residents. And we believe that this is a really vital piece in order to protect SafeP residents, in order to protect their rights as clients, as people, as patients. And so that's what we recommend for SafeP. Thank you so much, Doug. We also, in our interviews, we pulled a lot of quotes, and a lot of quotes unfortunately did sound like this. One of our interviewers said it was horrifying, the unit was dirty, nasty, the food was just old, just horrible, out of control. The counselors were very lax. As you can see, like these are experiences of people who have been in SafeP and who have really needed the kind of substance use treatment that SafeP tries to offer. But we can see through quotes like this that we currently are missing the mark a little bit, and we really do believe that the taxpayer dollar of $50 million per year can be used to go further. The other piece of it too is that when people recidivate, they are costing taxpayers additional money, right? If they were to go to SafeP and exit successfully and not recidivate, that's less money for the taxpayer. It also keeps communities safer. In relation to substance use crimes, lots of other crimes also decrease. And so we hope that SafeP can become a program that serves these people better in the future.
Thank you, Shruti, and thank you for leading this effort. I'd also like to just give a thank you to the entire research team, and in particular, Dr. Andrea Button with Texas Tech University, who has worked side by side with us on this research project as the principal investigator. We are just finishing the first round of research, which involves just extensive interviews, and then we'll be moving into the next phase after that. So any smart and innovative solutions that we're offering, there will be more, but this is what we know right now that would create dramatic improvements within existing programming. So thank you everyone who's participating in that. Could we go to the next slide, please? Wonderful. So it is an absolute honor to introduce you to my teammate and someone I admire very deeply. Her name is Maggie Luna. Maggie Luna has been with us for about a year. She serves as the Peer Policy Fellow from coming to us as on a fellowship from the Hogg Foundation for Mental Health. And she also spearheads our statewide leadership council, which she can introduce. So Maggie, do you want to take it from here and talk about common sense parole strategies?
Yes, thank you so much, Doug. And first, I just want to say I'm so grateful to be part of this team. I mean, these people are brilliant, and Doug is an amazing mentor. So, also, the Statewide Leadership Council is the brainchild of Doug Smith, and what it is a project of TCJC. And we are a group of directly impacted individuals. So we have people all across Texas who are advocating for common sense legislative changes. And we're driving those changes because of things that we've seen personally. And so today I want to talk to you about our common sense parole. So since 2005, the average length of a sentence for people in TDCJ has increased by 35%. So this coupled with low parole approval ratings has resulted in higher costs in the prison. We are paying medical expenses for the aging population inside of TDCJ. And so what we're finding is that people with a 20-year sentence are coming up for parole at 10 years and denied with no feedback, um, and no option to correct whatever the reason for denial was. And so that is sending them back for another 12, 13 years or whatever the case may be, and still getting a denial, and nothing has changed in these years. And there's no way for them to know what they could do to be eligible for parole when they do come up again. And then they come up for parole and they get approved, and then nothing has changed. So all of a sudden they're sentenced to drug treatment programs, which is years later. The person has been in prison, could have completed all of this programming in the beginning before becoming eligible for parole. So that's our suggestion is we're hoping that we can get these individual treatment plans to the person incarcerated quicker. And I've noticed from all of the people that's on the statewide leadership council, people who have been inside of TDCJ, who have been denied parole several times, who were doing their programming and just had no idea why they kept getting set off. And so had they been given their individual treatment plan and the option to attend these classes that would make them eligible for parole, um, they would know what to work for. But they continued to be denied, which leaves people hopeless. Like I'm continuing to do my whatever programming I think parole may like, and it's not working. So it gives a sense of hopelessness. And um, we don't all want to go to prison and stay the same person. We don't end up in prison on our best day. And we would like to take control of our rehabilitation. And so I think that it's really important if we were able to have something tangible that we could work for, and then whenever parole sees us, it's reflective of what we've done since day one. And so we just think this is a common sense um, approach to it. With all of the denials that we've done, or we've had, TDCJ denies about 50,000 people, parole eligible people per year. So this costs, all of these parole denials cost about $1 billion a year. And then at the end, they get approved, and then we still have to wait for programming. And we've noticed that during COVID, there are people sitting in prison who are eligible for parole, been granted parole. They've been incarcerated for 10, 15 years, and now they're waiting on programming, which could have been completed 10 years ago. So if this were already a practice, we would have less people sitting in prison from and ready to go home, just waiting on a program. So we are suggesting that we provide each individual with a copy of their individual treatment plan within 45 days on intake, place that individual into the appropriate rehabilitative programming, especially programming that is currently accessible through BPP votes, the Board of Pardon and Paroles, prior to their first day of parole eligibility. We're asking that we allow the Rehabilitative Programming's Division of TDCJ to be responsible for providing reports to the Board of Pardons and Paroles on the incarcerated individual's progress, and to allow the division to revise the person's risk assessment following program completion and base their parole decisions on a person's progress towards completing their individual treatment plan. So this is one of our recommendations, and I know a lot of people personally that would be impacted by this, and so we hope to get some work done on this. Thank you so much.
Thank you, Maggie. Thank you. And this is we love this infographic. One of our other team members, Catherine Salinas, helped to develop this, and she's not on this call. For folks who want these types of graphics to really break down how the system could work in a more rehabilitative fashion that actually saves money and improves public safety, we'd be happy to provide this to you. Just want to circle back. I saw a question and I don't want to miss it. It was asking about the stat about safe Ps not being independently researched in 20 years. Was that at the state or national level? Shruti, do you want to field that?
Absolutely. So SAFE-P refers to Texas specific programs. So when we say that they haven't been independently reviewed, we're talking about SAFE-Ps in Texas. That being said, programs like SAFE-P exist across the country, and across the board, they're very, very poorly researched. There's not a lot of data on them, on their success rates or anything. So that's where the research part of this project came in.
Thank you, Shruti. Wonderful. So thank you for the questions. Let's keep them coming. And we'll move on to the next slide. So I am going to turn it back to my team member, Devin, to talk about opportunities to create better pathways to housing for people who are leaving incarceration.
Thank you again, Doug. For reentry, we have a really comprehensive solution to it. But first, I want to talk about what are we really looking at with reentry currently. So approximately, we're looking at about 28,000 people are paroled each year from incarceration, and then from paying their debt to society, and now they're going back and they begin the process of reintegrating back into society. And so one of the big things is that a housing plan is super necessary for people, but one of the big things is that a lot of people are being funneled into residential reentry centers, RRCs, which are privately ran reentry facilities. But there's only about 2,000 beds. There's 8 centers throughout the state. And so that leaves about 26,000 people every year left outside of that programming specifically. And then we have the option for housing plans. One of the big things is that only a small percentage of people get approved for this because their housing doesn't necessarily meet the standards established, or the housing isn't necessarily good for them, so it's not a rehabilitative environment, which is something that they also see occurring in residential reentry centers. So with the lack of beds and as far as housing alternatives, we also have the financial and social detrimental effects. So when someone's not approved for their housing plan and they can't get a bed in one of the RRCs, they end up being still in prison. Just like Maggie had mentioned with parole, without the approval of a housing plan or a place to go necessarily, people aren't being released. And so let's look at the financials of that. Daily, in prison, one person, the cost of that is usually about $1,800, close to $1,900. And then if we get them into one of the 2,000 beds, then we're spending about $1,400 per person per monthly. I'm sorry. And then we have alternatives to housing like Oxford houses, which aren't as widely available because of certain stipulations that are currently available, but those run about $500. And then housing similar to that, or apartments where we could use housing vouchers, we would be looking at $500 to $900. And if you want to put that in an annual stance, you're looking at about $16,000, close to $17,000 per individual to be in an RRC, or we're looking at about $6,000 for someone to be in an Oxford house. So again, saving taxpayer dollars and also giving us the opportunity to rehabilitate people within our own communities. So our solution for reentry is to really look at, we want to establish a task force that sets housing standards. We don't want anyone to be taken advantage of just because they get some, what looks like decent housing. We want to make sure it's going to meet standards that are good for them, rehabilitative, and also keeps the public safe, bettering the community as a whole. And then on top of that, take some of the pressure off of TDCJ and all the amazing work that they're already doing by branching out that power with some of the task force members, which are all specialists that emphasize their work is all focused on people in reentry area. And then on top of that, transitional period. So people that work with people experiencing homelessness, people reentering society from military, and people reentering from incarceration. One of the big things, part of the task force, we also want to bring in someone that specializes for women's justice and family reunification. A lot of people are eligible to be reunited with their families, and we want to take into account that stable housing is a big stipulation that we want to try and ease those efforts. So again, we can better our family units as well. And then we want to shift to a model that expands the use of housing vouchers. So TDCJ has these vouchers that we can apply. And if we applied it more widely, we'd be able to get less people. We'd be able to have less people in incarceration, and also help TDCJ get that the use of that program that we already do have, but emphasize what we can do with it. And then lastly, we want to develop a needs assessment, whether it's someone having specific charges, like sexual offenses, making sure that there's housing for them and they're in the right programming. And then on top of that, setting standards for housing. So making sure, again, that we're keeping people safe on both ends, making sure that we're giving people the best opportunity to re-enter society. Because as we believe, people have paid their debt, and so we want to bring them back in to lower recidivism, and to also help people not relapse if they have a substance use issue or anything like that. So the reentry housing solution, we believe, is something that's really comprehensive that tackles a lot of issues.
Thank you, Devin. Wonderful, great. Let's move on to the next slide. Okay, I'm so happy to introduce my team member and the lead of our youth justice team, Alicia Castillo. Alicia, do you want to take it from here?
Yeah, thanks, Doug. And thanks to all of you who are joining us today. We appreciate you taking the time out of your busy session day to learn a little bit about some of these cost-saving measures for communities. So what I want to talk about today is some of the changes and updates that we can make to our youth justice system and our education system to truly transform youth justice in Texas and help us realize the Texas model that we started to build a foundation for back in 2006. So in that year, the Texas legislature, along with TJJD, what became TJJD, ended up passing some omnibus legislation that was really transformative and moved us from about 5,000 kids in the population of TJJD to under 1,000 kids today. And so I also want to applaud TJJD's efforts in light of COVID-19 to continue to safely decarcerate the population by moving that number from under 1,000, which is what it was last year, to about 700 today. So we know good things are happening and good changes are taking place. But despite all that, there's still some progress to be made. So we know that about 40,000 kids are referred to juvenile probation every year. We have about 10,000 kids on average involved in the juvenile justice system per day. And it's a big number. It's a lot of kids that we really have to start beginning to think about what alternatives there might be to that justice involvement, because we know that that initial justice involvement leads to a decrease in school success, a likelihood of graduation, and then future likelihood of incarceration as adults. It's also incredibly expensive to incarcerate a child. We're spending about $175,000 each year per child in our state secure facilities at TJJD. And then one of the reasons that I want to talk about education justice, or some changes that we can make in the education system to mitigate this problem, is that school to prison pipeline. We know that in 2015, about a third of kids were being referred to probation from behaviors that occurred in the classroom. We know that there are just some of those behaviors that might be able to be better managed in schools if only we give teachers and administrators the tools that they need to manage those behaviors in the child's community. So some of the solutions that I want to talk to you about are what we can do to move into this next step of the Texas model, and some of those other things that we can do that will just bring initial cost savings and significant reform. So for example, I mentioned that legislation back in 2016. We are asking the legislature this session to do part 2 of that legislation. Essentially, it's been 15 years since we passed that, and so it's just time for some updates. And in a sweeping youth justice omnibus bill in 2021, some of the things that we're hoping to be included are raising the age, raising the lower age, and some smart juvenile probation reform. So going to raise the age, this is a big issue for a lot of folks, because Texas is only one of 3 states that remains charging 17-year-olds as adults automatically. It creates a litany of challenges for 17-year-olds once they are released. It also creates challenges for them in facilities. There was one Texas study that kind of examined the operational impact of raise the age, and showed that raising the age of juvenile jurisdiction to 18, it'll have a net benefit of about $88 million for every cohort of 17-year-olds that we end up moving to the juvenile justice system. We have some updated numbers that reflect what's happened since COVID-19. And with those numbers, we anticipate that that number of savings could be much, much higher. Another aspect of some sweeping legislation could be raising that lower age. We are currently charging 10 and 11-year-olds as juveniles, and so they can be charged as delinquent. And in 2019, there were 435 probation referrals for 10-year-olds and 1,200 referrals for 11-year-olds, which represented about 9% of the total referrals for kids to the juvenile justice system. Probation chiefs, law enforcement, many folks agree that 10 years old, 11 years old is just too little to hold a kid in a jail cell, and that those kids could be better served outside of the criminal legal system. And so we're asking Texas to take that step and go ahead and change that age to 12 years old, so that communities can serve those kids who need support in their own communities. So I want to talk a little bit about what juvenile probation reform could look like. Currently, just like in the adult system, probation is regarded as one of the best the alternatives to incarceration, but it's also kind of that gateway into the criminal legal system for kids. So currently, one problem that we have is that any surplus dollars that are coming from probation departments as a result of diversion efforts decreasing their populations, all that money has to go back into general revenue. Probation chiefs that we're talking with, they agree that it would be much better if those dollars went back into the community to support those efforts to divert kids from the system. So we're just asking for this slight change to establish some community reinvestment funds in communities as a result of those saved surplus dollars from probation, so that we are building up the communities that are making an impact in diverting kids from the system. I mentioned before that a lot of those kids that are coming into the system are coming from behaviors that are occurring in the classroom. We know that it can be that teachers, administrators are under an enormous amount of pressure now more than ever, having to deal with the dangers of COVID-19. And we want to be really smart about planning for the future. What happens when these kids who are on average going to be about a grade level behind coming into their classrooms with frustrations about the content, the material that they're working on, without giving teachers and administrators new tools to deal with the new issues that kids will be having to handle as they re-enter classrooms. We project a potential increase in those kids that are being referred to juvenile probation, those kids that are experiencing exclusionary discipline like suspensions and expulsions, which would remove them to DAAPs and JJAPs, these alternative education settings that are run by the criminal legal system. We know that progress and success in school is a huge indicator for future success in children. And we just want to give schools all the resources that they need to make sure that that is where their focus can stay. And so we're asking the legislature to really leverage that CARES Act funding that we received as a result of the COVID-19 crisis, and also existing funding at TEA for from the Safe Schools allotment, which was established back last session in SB 11. We want to leverage all of those funds to strengthen social emotional learning supports and mental health supports in schools, so that we have age appropriate tools to get kids what they need. Lastly, we want to talk a little bit about Second Look. Maggie, my colleague earlier, mentioned the rapidly aging population in TDCJ. Unfortunately, a good number of that rapidly aging population went in as juveniles. We know that it's truly a crisis to have this rapidly aging population in TDCJ, as the state spent over $750 million in prison healthcare just during 2019. And that was a huge increase from 7 years earlier. So we know that these trends are increasing, even as we become more progressive in how we sentence youth. Those kids who were sentenced prior to these changes are still sitting in prison. So we're asking that the legislature direct parole boards to give folks who were sentenced to extreme harsh sentences as youth a second look at parole eligibility. We're hoping that for those kids who were sentenced to 40 years in prison, that we could give them that second look at 20 years or whatever half their extreme sentence was. And depending on the percentage of approvals that occur out of a second look, Texas could save between $3.9 and $12 million just in that first 2 years following the implementation of second look legislation. So I touched on a lot there, but to kind of recap, I think we're looking, our hope is in this moment to really address the needs of kids in our communities by ensuring that we can divert them away from the criminal legal system and give them the tools in their communities that they need to succeed and to thrive. And all of this, in addition to saving Texas money right now, will really set us up for a future where we have safe and thriving communities across Texas. Thanks, Doug. I'll pass it back.
Thank you, Alicia. And I would love to turn it over to another of our team members whom I admire a great deal, and I'm just so excited to introduce you to Cynthia Simons.
Thank you, Doug. And thank you, everybody, for joining us and taking time out of your busy schedule to attend this webinar. And we hope that the information can be very helpful to what you're doing and very impactful. As of August 2020, there were over 120,000 people incarcerated in Texas prisons. Following a recent population drop of approximately 16,000 people due to rapidly declining crime rates and decreased felony court activity due to the COVID-19 emergency declaration. While this reduction seems promising and is saving taxpayers dollars, it's likely that the numbers will rise again once the pandemic subsides. So one of the best ways for states to ensure real public safety for all Texans while reducing overall prison population for good is to continue closing prison facilities and to invest into the savings into crime prevention and community resources. Crime prevention specifically includes items like substance use, mental health treatment, housing, and employment assistance and trauma recovery centers. We want to acknowledge and applaud TDCJ and the legislators for closing down the prisons that were closed down and that they were outdated and understaffed. Facility closure is especially relevant for the aging and understaffed prison units still operating in Texas. Unless the system is downsized, Texas will be forced to increase funding every year to maintain its 100+ units, many which are more than a century old. Furthermore, closing outdated or understaffed facilities in areas with high economic growth could create significant savings for the state. For instance, closing a unit built before the 1920s could save the state tens of millions of dollars. Texas spent $5.3 billion on criminal justice in 2018, including policing and corrections. This is an increase of 85% in state funding for criminal justice since 1998, and an increase of almost 20% since 2012. So we have some proposed solutions that would help keep communities safer, as well as help close down some of the prisons. Since 2007, Texas has saved a total of $3 billion in taxpayer dollars as a result of reforms that have decreased prison populations and have led to prison closures. To maintain this progress, Texas leadership should continue closing prisons, use savings to save on cuts that are critical to public healthcare services, and invest in crime prevention and community services.
Thank you, Cynthia, and absolutely wonderful team. So I think it's important. We've seen some real opportunities here, and even with closing prisons also gets supported by continuing to make the types of changes, keep reaching for better innovations, lower cost, better outcomes. But it's important to close out with transparency, that the legislature and the general public knows that money going into our prison and youth justice system is creating good outcomes, that people are protected, and that there is oversight over those funds, just like in other systems. So I'd like Josh Kemp, who is on our team, a new team member, and to close us out, just talking about how to improve outcomes through independent oversight.
Hello, everyone, and thank you, Doug. I'm a policy associate with TCJC, and I just wanted to take a few moments to talk with you today about independent oversight within TDCJ. Currently, House Bill 1598, that's 1598. We believe that independent oversight is a key element in ensuring transparency and quality of care within state-run facilities. This measure has already been implemented within the Texas Juvenile Correction System and also within the Texas State Supported Living Centers, Health and Human Services to great success. We believe using data from positive efforts made in other states such as New Mexico, Arizona, New Jersey, that inmates along with their families and correctional staff are seeing the positive results and cost savings related to independent oversight efforts. This program in Texas is not meant to be another entity to highlight failings within the TDCJ system. This oversight office would be focused on working with TDCJ to strengthen relationships between inmates, their families, and TDCJ, and to help prevent many of the different issues that lead to costly litigation yearly. In short, we just insist that independent oversight is paramount to continued trends of lowering prison costs and recidivism rates in Texas. And we would greatly appreciate your efforts in helping us support that. So thank you for your time.
Thank you, team. This is, we have an amazing team. I'd like to know for those of you who are in legislative offices, I know you're taking time out of your day-to-day, that we are available to do individual briefings, to answer your questions, and support you in any way that we can. I want to just see if there are any questions from those who took time to be with us today. Saw some folks asking for the link to the presentation. So we created a link for you so that you can have that presentation. And we also gave you the link to Spend Your Values, the portfolio that the team developed. I'd like to also give a thank you to Lindsay Linder, who was one of our just outstanding leaders on this team and is now doing incredible work down in Harris County, who's on the line with us today. And this was one of her babies, so thank you. All right, I see some thank yous and just want to kind of leave this open for questions. Any questions? All right. So Maggie, while I'm waiting for questions, could you just share a little bit for those who are interested in, who might be interested in the Statewide Leadership Council or the Women's Coalition? I'll ask Cynthia as well. How do they get involved?
So the Statewide Leadership Council, like I said earlier, is a group of formerly incarcerated individuals. And we also have family members who have been directly impacted by the legal system. And so if you would like to get involved, we have a Facebook page, the Statewide Leadership Council, which I will be posting this video later onto our page. And then you can also reach out to me at mluna@texascjc.org, mluna@texascjc.org. And we have meetings on Sunday nights to talk about our goals throughout the session. And we're also going to be having a visioning session in Beaumont on the 20th. So if you would like more information, just either look us up on Facebook or contact me personally. Thank you.
Thank you, Maggie. And Cynthia, do you want to talk a little bit about the Women's Coalition and how to get involved?
Absolutely. So the Texas Women's Justice Coalition is a network of women who have been formerly incarcerated or have directly experienced the effects of incarceration from a family member or they're part of an organization. So we're a network of women who are very tightly knitted and we support each other. And if there is an obstacle or a barrier that a woman faces upon reentry, we're able to navigate and network amongst ourselves and come up with solutions for the obstacle. And we also come together and address policy that needs to be implemented, changed, or recommendation on policy that has been changed. There was a big push for women dignity bills, HB 3227 last session. So we're very happy about the programming that has been developed off of that implementation. And we're working diligently to make recommendations that would make things even better. And we have meetings once a month and you can get involved by emailing me.
Cynthia, you went off on mute. There you go.
Okay, I'm gonna drop. Sorry, technical difficulties. I'm going to drop my email in the chat and you're welcome to email me and you can sit in on a meeting and see how you can get involved, see where you best fit. We'd love to have you and we'd love all the resources and networks that we can get out there. So if you're aware of organizations or different entities that can help women in reentry or are focused on women's rights, women's justice, please feel free to reach out to me. Thank you.
Thank you so much. I want to thank everyone for attending today. I want to thank our team. This is just an incredibly meaningful to be on this team. I've worked with us for about 6 years. For those of you who aren't as familiar with Texas Criminal Justice Coalition, we're deeply committed to centering the leadership of those most directly impacted by the justice system, and many of us have had justice involvement and have family members who are justice involved. So we bring policy expertise that we'd love to share with you, and we also bring real experience. So we appreciate the opportunity to be a contribution to your work. And for those of you who are involved, we invite you to be part of our work. So thank you very much. And with that, this webinar is complete. Have a wonderful day and stay safe. Don't drive on the icy roads.